That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Now read the question.
Michael Juarez, he's a 64-year-old here with onset AFib, a history of type 2 diabetes, and a stage 2 wound on his left sacrum. He's allergic to penicillin. He's married and lives at home with his wife, who has Alzheimer's. Okay. He's alert and oriented times 2, and he's unable to ambulate independently. OT worked with him yesterday. He responds verbally. We're actively titrating his amiodarone drip. His lungs are cleared. His blood sugar was high before breakfast, and he got 7 units of insulin. His last bowel movement was 2 days ago. He's retaining urine due to BPH. He's on a cardiac diet and is due for a stress test at 10. Did you get all that?
Wow, this is a heavy load. I better get started.
There's a new admit coming from the ED. It's your turn to take it. He's coming to room 346, and the nurse will be calling with report.
Okay, thank you.
Good luck.
Question 26. Now read the question.
Do you need something?
Yeah, I think I'm going to need some help with my patients today.
All right. Okay, I just sat down. Give me a minute. I don't understand these new nurses. They don't want to work hard. They think everything should be given to them. That we should just stop what we're doing and help them. This place is going to send me to an early grave. I've had to precept all these new nurses and manage 40 beds. We never have enough experienced nurses. And now our patient satisfaction scores are way down. I'm tired.
Question 27. Now read the question.
When I asked you for help earlier this morning, you seemed a bit upset and overwhelmed. I know we've been very busy on the unit and we got slammed this morning, but the response made me feel demeaned and a little embarrassed. It's important for me to feel supported and respected when I ask for help. And with your help, I know I can be a great nurse, I can support the unit and you, and we can together better care for our patients.
I am so sorry, Jaslyn. I did not intend to make you feel bad. It's been a crazy morning. Besides everything here, I got a call that my mom fell at the nursing home.
No.
And you know, I got all those monthly reports due at the end of the day. I do value you, and I will remember that. Let's get going.
Question 28. Now read the question.
Hi, Dr. Walker. Yes, this is Carolyn Hall. I'm calling concerning Virginia Wolf in 347B. She's a para 1, gravida 1, and she has a massive amount of bleeding that saturated her bed and is pooling on the floor. Yes, and right now she's unresponsive and her blood pressure is 86/40. Her heart rate is 122, her respirations is 12, and her O2 sat is 90% on room air. Yes, she had an uncomplicated vaginal delivery this morning, and we gave her some Percocet and Ambien about 90 minutes ago. She has a saline lock on in her right arm, and it looks like a hemorrhage, and I think you should come and assess the patient.
Question 29. Now read the question.
Oh my gosh, what is wrong? What do you think is wrong with her?
It's not unusual.
But why is she bleeding like this? Look at the blood on the floor. The nurse, it's just awful.
It's not unusual for a mom to have the baby and start bleeding. This is not unusual.
She's not talking to me at all.
She'll talk. The nurse is calling the doctor.
Okay.
And sometimes after having a baby, the uterus is not contracting as it's supposed to. That's what's going on. That's why the primary nurse asked that I massage the abdomen.
Okay. Do you
so
think we'll
that
have
we
to
get
give
it firm.
Do you think we'll have to give her blood?
Okay. Okay, let me read that back to you. You said you want normal saline, 1 liter bolus, IV, O2 on a non-rebreather, and you want her to keep her SATs greater than 96.
Question 30. Now read the question.
The situation is that a 42-year-old female with signs of chronic liver disease presented here about 2 hours ago with pre-syncopal symptoms after hematemesis and melena at home. On arrival, she was tachycardic and hypotensive, but responded well to fluids. We were working her up as a variceal bleed when she had this further large hematemesis. She's now looking shocked again, with a pulse of 110 and a BP of about 80 on 50, and we are about to start a unit of blood, a PPI and some octreotide. On exam, there is no evidence of ascites, so I haven't started antibiotics.
And
No other background story known at this stage, other than 10 years of high alcohol intake of about 60 grams a day and a 30-pack a year history of smoking. She's not had much in the way of investigation for her disease yet, although she does say that her GP told her that drinking had caused severe damage.
That is the end of Part B. Now look at Part C.